In today's video, I'm going to go over the top 3 pickleball injuries and how to fix them. One sport that has become very popular nowadays is pickleball. It's a great sport for people who want to stay active, but maybe don't want to go as far as playing tennis or other activities such as running. It's also a very social sport too. It's really good community as well. But as it's gained in popularity, we're starting to see certain injuries come into my office. And so what I want to do is I want to go over the top 3 injuries we see and then how you're going to fix them at home. Before we get into the top 3 injuries, let's talk about just overall mobility prep before you start playing. Because it's so popular, we're seeing people jump from playing nothing at all to 5 days a week. And the problem with that is, just like running, you wouldn't want to go from running nothing to a 5K or 10 miles at a time. You got to let your body get used to that amount of movement. And so there's a few things that you can do to help get your body prepped for playing pickleball. One is to increase your mobility and flexibility. So because we all sit at computers all day long, a lot of times certain muscles in our legs, our hips, and our shoulders become very tight. And so what we need to do is we need to loosen up our shoulders. We need to stretch out the trapezius muscles up here. We need to work on our posture and stretch out our muscles in that shoulder blade region. But it's also important we work on the flexibility in our lower legs, especially our hips, our quads, and our hamstrings and calves. If you prep your body for playing pickleball, you're going to reduce the risk of injury significantly. Now on my channel, I have other videos going over how to improve the flexibility and mobility in these areas, so we'll check them out. It's really important that you understand we need to gradually build up the amount of time we're playing. And that is really going to reduce the risk of injury. It's also going to help you enjoy the sport better because you're not going to be dealing with these chronic injuries as you're playing, and you can play more and more as your body gets used to that amount of tension. So let's go over the top 3 pickleball injuries and I'll show you how to fix them. The most common pickleball injury I treat is elbow tendinitis. Now, elbow tendinitis can occur either on the extensor side, this top side, and that brings your wrist back, or it can occur on the inside part of your elbow as well. This is most commonly referred to as tennis elbow, and that's usually on the outside, where golfer's elbow is on the inside. And what will happen is these forearm muscles will get really tight just from gripping the racket, and that will cause pressure on the tendon, and then over time that causes the tendon to become painful, and then it hurts to grab the racket and make any kind of gripping motion there. Same thing for the inside. These wrist flexors here will get really tight, and then it puts a lot of pressure right on the inside part of the elbow and causes a lot of sharp pain right through there. At home, what you can do is you can take either a massage gun or a lacrosse ball and go up and down the forearm muscles to help take pressure off of the elbow. You can also obviously ice the elbow itself, and that would be good for pain relief and to get down any swelling or irritation. But what you need to do is you need to loosen up these forearm muscles to take pressure off of the elbow. If you're suffering from chronic elbow tendonitis, I recommend this product. It's called the Roll Flex. And basically what it does is these rollers massage your forearm as you're passing your forearm through the device, and it massages deep into the forearm. And unlike the massage gun and lacrosse ball, they're great, but they can't get as deep as this Roll Flex. And you can pick it up on Amazon. I want to say it's like $60 or $80, but it's a highly effective treatment for elbow tendinitis. So what we're going to do is I'm going to have Renee demonstrate the Roll Flex and how you would use it both on the inside and outside part of the elbow. So to use the Roll Flex, what you're going to do is you're going to stabilize it on your thigh, and just like that, and you're going to open up the Roll Flex, and Renee's going to grab it with her right hand if she's going to be treating her left forearm, and then she's going to position her left forearm into the Roll Flex. Now the side that is going to be treated is the yellow side. So what she's going to do is she's going to lightly kind of clamp down on the Roll Flex, and she's going to move her forearm back and forth through the device. And what it does is it massages these muscles in the forearm and helps to get in there and deep and loosen them up. And what I would do is I would go back and forth anywhere from 20 to 30 times, moving on to different parts of the forearm until it kind of releases and loosens up. And what you want to do is you want to press too hard. You want to go back and forth so you feel a light to moderate dull ache in the muscle, and then that's good enough, and then you can move on to the next spot. To treat the inside part, what we're going to do is just reverse it around. So we're going to put it like this. Now the inside part is going to get that part of the forearm, and she's just going to go up and down. Now we don't want to be right on the bone, so we'll go up right to that attachment point, but anywhere through the main portion of the muscle belly I would treat. And even if you're dealing with lateral elbow pain, I would still treat the inside part, because sometimes if this is tight, it causes you to work extra hard on the outside part. So treat both sides 20 to 30 times, and you can do this daily initially, and then space it out once every other day, and then once a week. And it's a good just maintenance tool. I use it on a regular basis just to keep my forearms loose. So if you're playing a lot of pickleball, you may want to use this on a regular basis just to keep your forearm muscles loose. The second most common pickleball injury is going to be knee pain. With pickleball, there's a lot of lunging, there's a lot of quick movements, and what happens is that causes a lot of stress and strain on the quadricep muscle. So if you're already dealing with any kind of knee arthritis or chronic knee pain, this is going to make it worse. This can cause swelling and irritation inside the knee, and by loosening up a lot of the quadricep muscles, that'll take a lot of that tension and pressure off of the knee. So there's 4 portions of the quadricep that we want to work. The first part is going to be right down the center. So what we're going to do is use either a foam roller or a massage gun, and we're going to go up and down that quadricep and find any of these tender spots. Now, we don't want to press too hard where it's really uncomfortable and unbearable when you're pressing into it. We want like a light to moderate discomfort as you're working it. So what it's going to look like is we're going to come off right off the front of the pelvis here and go right down the center portion of the quad. And I want to work all the way down to right above the kneecap. I don't want to be on the bone here, but come up like an inch or 2 off of there, and that's where you're going to find the bulk of the muscle right there. And again, go up and down, find those tender spots. When you find that one spot, go back and forth 10 to 15 times, and then move on to the next section. So that's the first one we want to treat. The second portion we want to treat is this vastus lateralis, which is this muscle here. So it's actually kind of between your IT band and the first quadricep. And this is the bulk of the quad muscle here, so it's often very tight and can cause a lot of knee discomfort. So what this is going to look like is we're going to kind of work that seam of the pants here, right between the IT band and the quad. We want a light to moderate discomfort, and then again, once we find some of these spots, you want to focus in on them. And you'll find them, they will definitely be sore and sensitive. Typically, one big trigger point is about 4 or 5 inches above the knee, and that's going to be right in through this section here. And you want to focus in on that section, and then move on to the next. And again, go about an inch or 2 right above the kneecap, and then go up. And while you're here, you can also move lateral and get more of the IT band too, because this muscle actually extends underneath the IT band, and so a lot of times actually IT band discomfort is coming from this quadricep. So once you've worked that muscle, then we want to work the inside portion of the quadricep. So this is kind of right in through here, so if you suffer from medial knee pain or pain on the inside, this could be the cause. So this is the muscle. If you contract your quad, it's almost like a teardrop portion of the muscle, so it's going to be right in here. And we want to work this. It's going to be often tender right here too. And you just want to focus in. Again, we don't want to be on the bone, but right above it. And then we want to work, and you can even extend into, we call this the adductor, which is on the inside, and work this a little bit too, because if you're doing the side to side movements, that will often get tight, and that can also strain the knee. The final portion of the quadricep is going to be deep to that first one we worked. So it's tough to get to. That's why I like to loosen it up with the first treatment. We'll kind of work the superficial layer, and then we'll go a little bit deeper. So to your tolerance, you're going to press in a little bit deeper, a little bit more pressure to get to that deeper layer. And this is going to be really helpful though if you're dealing with any hip pain or any kind of deep dull ache in the quad or knee area. And just go up and down. And again, you want to focus in on kind of the bigger portion of the belly of the muscle, which is right here. So use a massage gun or a foam roller to roll out the quadricep muscles, which will help take a lot of the pressure off the knee. The third most common pickleball injury is going to be Achilles or calf pain. Most people have a lot of tension and tightness in the calf muscle, and we don't stretch this on a regular basis. And what will happen just from a lot of the sprinting activities and a lot of the running in pickleball, that will cause the calf muscle to get even tighter. And what happens is when that muscle's tight, it puts extra pressure on the Achilles tendon. And then this portion of the calf or Achilles tendon can get really swollen and irritated, and it will either cause pain right on the tendon or actually right where it attaches into the heel. So to treat this at home, what we need to do is either use a lacrosse ball, a massage gun, or a foam roller, and roll up and down that calf area in the belly of the muscle to take pressure off the Achilles. Now, right on the Achilles itself, I would recommend icing it for 10 to 15 minutes at a time, especially after you played or if it's just bothering you and painful walking around. That's a great time to ice it. But again, to fix the problem, we need to stretch and loosen up the calf muscle. So what it's going to look like is we're going to turn on the massage gun here, and there's really a few portions I want you to treat. I want you to treat the main portion down the back of the calf, then the lateral portion and the medial portion. The inside portion of the calf is probably the most important, but you definitely want to treat all three areas. So what we're going to do is we're going to go up and down the calf, finding for any of these trigger points. We want to apply a light pressure so it creates a low to medium amount of discomfort in the area. I don't want it to be so painful that you can't move the gun up and down. And once you find a spot, I want you to focus on that trigger point, go back and forth 8 to 10 times, and then move on to the next section. You have to be careful as you get closer to the Achilles, because if it is inflamed, it is going to be really sensitive. So you may have to stop a few inches above. We don't want you to irritate it by applying the massage gun right to the painful spot. So next I want to work the lateral part of the calf here. And you're going to go up and down, again, finding any of these tender spots. For you, maybe this side is more painful than the inside, but just find where that spot is and then work it back and forth. Now, the inside portion, I'm going to show you on this leg, is really important. You want to find the tibia, which is the bone right here in our lower leg here. And if you come just posterior to it, that's going to allow you to get both the gastroc muscle, the calf muscle, and the soleus muscle, which are really big portions of the muscle. And this can cause a lot of stress and strain on the Achilles. And again, find those tender spots, work them. And a lot of times, again, you'll find it right down in through here, right on the back of the tibia bone here. And then there's a big portion of the calf muscle, which is right here. And I want you to focus in on that too. And again, go to tolerance. We want just a light to moderate amount of dull achiness. We don't want to make this super painful for you. So using a foam roller or a massage gun to work out that tension in the calf will help relieve the Achilles tendonitis. So if you're dealing with any pickleball injury, give my office a call at 703-912-7822 or schedule online at novacarwellness.com.